So I think let's get started and then people can join as they go along. Okay, so thank you to all of you who joined today. This is our last webinar in this first series, so thank you for all of your support. We've gone through the entire hormonal journey, starting with menopause, perimenopause, and then we are now ending at puberty. So without further ado, I'd like to introduce you to Dr. Fatima Betisi, who's a pediatrician. She's community-based with an interest in mental health and diabetes in children. She has a primary care and consult-based practice in Welland, and actively involved in teaching medical students, a pediatric residents from McMaster University, and I think nurse practitioners as well, right? From the University in Buffalo.
That's right.
So yeah, thank you so much for joining us today, and I'll hand over to you.
Thank you, Fatima Bain, for your kind introduction. And thank you, Rashida Bain, for roping me in for this presentation. So as Fatima Bain said, I'm a practicing pediatrician in Welland, which is in the Niagara region. I have been here for 18 years in practice. And today we are going to talk, it's the last talk in the Women's Health series, and it's about puberty. So we're going reverse. I know you all must have heard a lot of talks about menopause and all. We're going to go back to where it all starts. So my aim for the next couple of minutes that you're going to be with me is to go through understanding puberty and what every parent and a caregiver should know about this, because all our children are going to go through this journey. The objectives for this talk, as I just mentioned before, is understanding what puberty is, recognizing the normal signs of puberty in girls and boys, learning what to expect and when, and identify signs that need medical attention. So what is puberty? Puberty is a natural stage where bodies change from children to becoming an adult. It is a milestone in every child's life. And just how we celebrate a kid's first steps, when they they start talking, this is also something to look forward to. It is scary. It's very overwhelming, but it should be celebrated. It is very exciting time, and happens so that the children can grow and become adults. It is triggered by hormones, which are the chemicals which are there in our body, and these cause the physical changes. It's not only the physical changes that happen, there are also some mental changes that happen during this time, because you're getting ready to step out into the real world and just leaving your childhood behind. Girls are between ages of 8 and 13 when they start showing signs of puberty, and boys are between ages of 9 and 14. So why do we have to have this stage in our lives? This is a body's natural way of physically becoming an adult. It's when all the major organs and body systems mature, and it's preparation for sexual reproduction. There's also mental and emotional development that happens during this stage. How does it all start? It starts as something gets triggered in the brain, and this area is called the hypothalamus. The hypothalamus starts releasing the first hormone, which is called the gonadotropin releasing hormone. It goes to another part of the brain, which is the pituitary gland. The pituitary gland releases luteinizing hormone, which is LH, and follicular stimulating hormone, FSH. These two hormones then act on your sex organs, whether it's the ovaries or the testes, depending on boy or girl. They release the sex hormones, the estrogen and the testosterone, which then triggers puberty. So this is just, if you're a chemistry geek, then I just wanted to go through that, why these hormones are important and how does it all start. So we're going to go through puberty in girls and then puberty in boys in the slides next. So puberty in girls, it starts between age 18 and 13 years. There are multiple factors that can make you start the puberty. So it's influenced by your genetics, the health, and also the environment. 8 is the lowest cutoff, but it can happen as late as 13 years. In boys, it starts much later. So the lowest age is 9, and it can go up. It can start as late as 14 years. So how does puberty in girls progress? So first it starts with breast development, which in the medical language is called thelarchy. Then pubic hair, which is adenarchy. Then there is increase in weight, followed by increase in height. And then it's menarche. Menarche is the word for the first menstrual cycle. All these stages you have to go through all these stages for the natural progression of puberty. If you skip one of these stages, or you straight away have breast development and then menarche, that's a sign that something is going wrong, because this is the natural progression of things. So as I mentioned previously, menarche is the name for the first menstrual period for girls. It's usually about 2.5 to 3 years after the breast development starts. So around the age of 12.5 years is the first, on an average, it's about that age when the first menstrual cycle starts. And at the first few cycles can be very irregular. The other changes, there are lots of other body changes that happen during puberty. Skin becomes oilier, therefore there is acne. There could be body odor and armpit hair. Lots of emotional changes and causing mood swings, because everybody's trying to start getting more independent. And that's what's usually happening around puberty. The brain is also starting to grow. Just to remember the caveat, physical changes end with puberty, but mental changes continue. The brain continues to grow into the mid-20s. So that's why it's really important to know that the brain development is still ongoing. We are just talking about the physical changes that puberty brings in. So as physicians, we use something called as Tanner staging. It gives us a visual chart of how the breast development and pubic hair development goes on and with the ages. So it helps us to follow through and make sure that the puberty is following the natural progression. And puberty in girls typically lasts about 2 to 5 years from the time it starts. So if it starts at 8, expect to last for about 2 to 5 years. And that's the age, group that you can predict when the first menstrual cycle will happen. It typically ends around ages 15 to 17 years. So the next slide is the chart that we look at. It's called Tanner staging. It is the breast development and pubic hair that helps us to do the Tanner staging. It's not the armpit hair or acne that is important for us for Tanner staging as physicians. It's just part of the pubertal development, but breast development and pubic hair is what's the most likely to predict if puberty is going on as planned. So stage 1 is when you've not started your puberty. So there's no hair, there's no breast tissue. Stage 2 is the start of puberty. So you get small breast buds, you may start getting some pubic hair, and this is around the ages of 9 to 11. The breast development that happens may not be symmetrical. Stage 3, where the breasts continue to grow, they become more defined, and the pubic hair also starts becoming more darker, coarser, and starts spreading down the mons pubis and the inner part of the thighs. Stage 4 and stage 3 is when you'll start seeing the change in the weight, more of the body getting formed. And between stage 3 and 4, that's when the height is starting to change and they're going through their growth spurt in girls. So stage 4 is when the breast development is almost looking like an adult breast, and the pubic hair have also started looking more like the adult hair, but they're still not as dense. Stage 4 is when you should expect the start of the menstrual cycle. Stage 5 is when mature adult breast size is achieved and the adult pubic distribution of hair. Some women develop a lot of hair down in the pubic area, which can go right up to their belly buttons, and that could be normal. The breast may be asymmetrical in some girls, and that's also normal. So there are lots of changes, and you need to know there might be some discrepancies. It will not look as symmetrical, and it will not look the same in every child, and that can be emotionally very difficult for a young girl who's growing. So menstrual cycle begins around stage 4. Initially, the cycles can be very irregular. They can last from 3 to 6 weeks in teens, and the bleeding can last for about 2 to 7 days. So when should we be concerned? We should be concerned if there's no breast development by age 13. If there is breast development and there's no menstrual cycle for 2.5 to 3 years after that, it's concerning. If there are no periods by age 15. Rapid or early development. So, the stages that I said, first breast development, then you get pubic hair, then the weight increase, then the height increase, then the menstrual cycle. If it doesn't follow that stage, that sequence, or it's happening too fast and not progressing over the 2.5 to 3 years, or if the child is less than 8 years, then it's of concern. Very heavy or painful periods may also be a concern. So now we're going to switch gears and talk about puberty in boys. So the first signs of puberty in boys is enlargement of testicles and scrotum. Then it's growth of the penis, and then there is pubic hair. So a little bit different, but they have the other changes might be the same. So they still get the oilier skin and the acne, they get the body odor, then there will be hair on the face, the voice deepens, and they get the growth spurt. The biggest difference in the boys and girls is, in girls, we get change in the body mass. So weight is a big one and the body curves are formed. Whereas in boys, it's all about muscle mass that is increasing during puberty. So again, the same changes, the emotional changes are the same in boys and girls. They have increased interest in independence. They're aware of their sexuality. There could be mood swings. And again, the emotional and behavioral changes also happen with boys. So we use a Tanner staging even for boys. And this is a visual guide, as I mentioned, for girls. So the same kind of visual chart that we have for boys. And it's the lower part of this chart right here. I don't know if y'all can see my arrow. So it's looking at scrotum and the penile growth. So in boys, we're not talking a lot about facial hair, voice deepening. It's not about that. It's about actually penis growth and testicles. So stage 1 is prepubertal, which is under the age of 9. There is no pubic hair and there's no change in the testes, and the penis looks smaller. Stage 2 is when the testicles enlarge, the scrotal sac skin becomes thinner and starts getting more darker, and they may be developing a little bit of hair at the base of the penis. Stage 3, which is around the age of 11 to 13 years, the penis begins to grow and the testes begin to grow, and then more pubic hair. Stage 4 is when the penis grows in length and width and the scrotum becomes darker, and the pubic hair also increases. And stage 5 is the final stage when adult style genitals have been reached, and that's usually marks the end of puberty. So stage 4 is again the important stage, and the growth spurt happens around that time, and that's where usually the adult height is reached. Just to remember that the girls reach almost 85% of the adult height by stage 4, and same thing with the boys. After that, there's very minimal growth in the height. The adult height is usually reached around stage 4. Also, stage 4 is when semen production starts in boys. And that's also important to know. I'll go through in the next slides, but that's also an important change that's happening for the boys. So in this slide, we're going to talk about the semen production that is happening in stage 4. And that's causing the wet dreams and erections. And this is part of normal development. It's not something to worry about, but it's also important that we handle it with a lot of privacy and understanding, because a lot of kids feel that very shameful. They will not come and talk about it. They think it's not right. And that's why they have to be reassured that it's a normal part of pubertal development, just to make sure that they know that it's supposed to be a personal thing and they have to get the privacy for that. So when to be concerned in boys? If there's no pubic hair by age 15, there is no testicular enlargement by age 14, or you're seeing early changes before the age of 9. And one important thing with boys, which I just saw today, a young child, and it was very, it was a social stigma for this boy because he had painful and breast development. And also he had milk production from the breast with a normal part of puberty. So that can be very embarrassing for a boy, and he can get teased in school about it. So that can be something that can be brought up to your daughter if it's something really of concern. So puberty comes with its own baggage. There are a lot of emotional swings, emotional sensitivity issues happening at this age. It's a very emotional, overwhelming time for the kids at this time, especially if they start around the age 8, especially for girls. They sometimes are not mentally prepared for all these changes that are happening, and they need a lot of emotional support from parents. Their body image issues, there can be self-esteem issues. And that can be a problem if you have puberty, if you start puberty early or if you start late because all your friends have gone through it and you have not, or you're starting much more before your friends, and that can also be a problem. The teens become more self-conscious, and there's lots of influence of media and peers, and they start reading things on internet and the friends are talking about it. So we have to be ready to answer all those questions. So I got this from the Cleveland Clinic, and it talks about how to navigate puberty with your child. We're going to go through it in the few slides, but important is remember their body changes happening. We have to be a role model for them when they're going through that. Respect their need for privacy, but be open that they can come to you with all the questions that they have, and you can help them through all the emotions that they're feeling and set appropriate boundaries for them. So few things. Inform them that the body is changing. Educate them about the sexual reproduction. The main thing when you're talking about the body changes, make sure you use the correct terms, but simple explanations. With girls, especially, you're preparing them for their first menstrual period. So it's very important when you know that they've started having their breast development and pubic hair, and you know that it's progressing, be prepared for that. Talk to your child, see what will happen if they start their menstrual cycle in school. Whom should they approach? Who's their safe place? Can they call you? If they don't have a phone, then can they talk to their teacher? Do they have I usually ask the parents to make a small bag, and where they can keep the things like an extra underwear, a pant, even a tampon or a sanitary napkin, depending on what you all have as a unit you all have discussed what you're going to use for the menstrual period. So make sure that your child is armed and ready for this big change that might be happening in their lives. They're experiencing fear. This is the first time, especially when they see blood. A lot of kids get scared of that. They're confused. They're looking at their peers and they don't know what's happening. Their body is changing. They need the privacy. They're looking for privacy, but they're also looking for you as their support system. Listen without judgment. Be honest and open with your child. Set appropriate boundaries. Make sure that they know the safety rules and set clear age-appropriate rules. We'll talk a little bit about hygiene because that's really important, especially when they're going through puberty and also in prepubertal children. I see that a lot, especially because a lot of times it's just too much of wiping and too much of using soap in the area. And that the vulva is very sensitive, especially in a prepubertal girl. So avoid using bubble baths, scented soaps, wipes. Wet in the summers, it's a wet swimming costumes. They all can irritate. The area just needs water to clean and mild soap once a day. If they're in school and they're going to be using toilet paper to wipe, it should always be wiping front to back, and that prevents a urinary tract infection. Cotton underwear is the best. Avoid tight synthetic fabrics. The way I put it is let your area breathe. It's really like treating, if you using diapers in babies, it's the same thing. You always say like, let your area breathe. It's the same concept as the girls are growing older. So vaginal irritation and discharge is common if you're using soap or there's poor wiping habits. Redness, itching, discomfort. You may even get pain on urination. It's usually not due to infection. It's sometimes just because of the hygiene issues. See the doctor if there is persistent odor. There's thick discharge. Clear white discharge is normal, and that can happen just before you start your first menstrual cycle because of the increased estrogen. But if it's a thick white discharge and it has a foul odor to it, that's when you need to see your doctor. Or there's pain, or there's bleeding from the vaginal area, which is not related to the menstrual cycle. Avoid overcleaning. It can cause irritation. For boys also, it's very important. They have to clean their private area, the penis, groin, bottom. Avoid bubble baths and scented soaps around the genital area. Encourage changing into the clean underwear daily because they can get very sweaty. Teach cleaning thoroughly after bowel movements. And also if they go into the gym, because a lot of boys at this age, when they start going through puberty, want to go into the gym and they get very sweaty. And it's very important at that time they remember to clean themselves. So just going through general hygiene tips for all kids. Daily bathing, change underwear and socks daily, trim the fingernails, wash hands. We talked about private part hygiene, and make hygiene, and definitely talk about it in a positive, shame-free environment. So the next few slides are just a recap on, again, when you need to seek medical attention. Either you're worried that it's early start of puberty. So the few numbers that I want you to remember: girls, age 8, boys, age 9. If they've not started their menstrual cycle by about 15 years of age in girls, or they've not started their periods after 2.5 to 3 years of started of breast development. For boys, if they're age 14 and there's no signs of testicular penis growth, then seek medical attention. If they have breast development that is very painful, asymmetrical, causing some milk discharge, especially in a boy, and the child is getting affected emotionally, getting bullied at school, seek medical attention. There's severe or heavy bleeding with menstrual cycles in a teenage girl, missing school. That's not normal, and they should seek medical attention. A good way to know when to predict menstrual cycle, apart from all these things that we went through in the last couple of slides, remember your age as a parent when you started your menstrual cycle. That may help. Or when the sibling, if the child has a sister, that may help to predict the start of the menstrual cycle, because genetics does play a role in how the puberty progresses. Also see the doctor if your child is struggling with all the body changes that are happening with puberty. This is also a time when they may develop eating disorders related to the body changes, or depression. Heavy acne that is not getting better. It can cause scarring and then further affects body image issues. So all these need to get addressed by a family doctor. Support your child. This is at interesting times in your child's life. Encourage all the healthy habits that you have incorporated in their early childhood: nutrition, exercise, sleep hygiene. Make sure you are looking at which websites they are going to get their information. Be open and be responsive to their needs. Deodorant, shaving, and skincare should also be some discussions that you may want to have with your child. Talk about menstrual hygiene, regular showers. Talk about sexual health in age-appropriate ways. Use medically appropriate information and terminologies. Talk about consent and safety. Don't wait for them to ask. There'll be lots of mood swings during this time, so be prepared. Plan for peer pressure. Give yourself grace and give your child grace. This is a very important time in your child's life and your life. It's a milestone. It is overwhelming for you as a parent and also for the child. So I'm just going to end with a few key takeaways. Puberty is a normal part of growing up. It is very exciting, but a challenging time for you and your family and your child. There are lots of changes that happen, physical and mental. Your child is turning into an adult, trying for independence, but still not there. Every child is different. Be open and supportive and know when to seek help. Thank you so much for your attention, and I'm happy to take any questions.
Thank you very much, Fatima Bain. That was really informative. I just had a question about, these vaginal washes and Vagifem products. What's your take on it and whether they should be used in pubertal girls or even women?
So I don't know about women, but usually for prepubertal and pubertal girls, it's usually just water. Water, non-scented soap once a day. And the main problem is the bubble baths that I usually get. Showers are the best. No bubble baths.
Yeah, that's a hard one to avoid, right? Because there's so
Yes.
much with the bath bombs and all of that.
And that's the fun part, right? I think we
Yeah.
want to be a woman and a girl because that's the fun part. So usually what I will say is that if you like to indulge in a bubble bath, maybe once a month or something is fine, but it should not be an everyday thing. The other thing is that if they want to play in the bathtub, they can just fill it up with water and it should be free flowing water. It's a stagnant water that causes a problem, and try to not use a lot of scented bubble baths. It's just like not, it should not be an everyday thing. I think that's the biggest issue.
Okay, great.
Thank you so much, Fatima Ben. That was very, very interesting. Um, I had a question, and I see this in my practice frequently, more so in girls, is younger girls, so less than 8 years old.
Mm-hmm.
So sometimes 5, 6 year olds, where their parents bring them in. And the main complaint is odor. So odor, like underarm odor.
Mm-hmm.
And they're concerned that their child is going through puberty at such an early age, but there's really rarely any other prepubertal signs. So no breast bud development, no hair growth, nothing like that. What advice would you give parents of children who are, experiencing that, and also for us as family doctors too, in terms of how to guide and if there's any tests or anything we should be doing for those kids presenting like that?
So that's a good question. I see a lot of that too, and that's especially in kids who are very active. So if there is no other signs, even if there is a little bit of axillary hair, but you're not getting any breast development, no pubic hair, most
Mm-hmm.
likely this kid has not started puberty. So if the age is under the age of 8, it's not early start of puberty. So I would not be worried about that. This
Okay.
could be just related to being sweaty, and hygiene is the topmost. So this is unfortunately a kid that would have to keep cleaning the underarms with a wipe or something and using a deodorant. And it's
Okay.
okay to use a deodorant, right? You get a lot of non-aluminum based deodorants now just to
Yeah.
keep the area dry.
Yeah, so that was going to be my follow-up. So a lot of parents are like, what type of deodorant
Mhm.
can we use for our children? Is there a one that's really safe? So you mentioned the non-aluminum ones.
Mhm.
So those are completely fine, safe to
Those are
use.
fine.
Yep.
Yes.
Okay.
And if they have really, they're sweaty all over and it's not just an armpit issue, then you might want to send to a dermatologist and make sure they don't have hyperhidrosis because there
Mm-hmm.
could be a familial history of being increasingly sweaty. But
Yeah.
otherwise, I usually just tell them to just continue with their daily hygiene.
Okay.
And a lot of kids carry their wipes, right? The scented wipes, and that usually helps, especially
Okay.
after sports.
Thank you.
Hi, Fatima.
Hello.
Hi, I have a question. What is it about using antiperspirant or deodorant? Which one is better?
For which
Or
age group?
pardon?
Which age group are we talking about?
Any age group that could be, even if it's a woman.
So I would not talk anything about adults. I would leave it to the family doctors to talk about that.
Okay.
But usually for kids, it's not about, as I said, antiperspirant is fine because they're usually coming because they're very sweaty. And most of the time it's related to a sport. If they're sweaty, not related to a sport, but they are always having sweaty palms and feet, then those are the kids that I would probably do some blood work. I would like to do a thyroid level and just, do some basic blood work and make sure that that's not something that is related to a underlying medical issue. But coming back to your question about antiperspirant or deodorant, it depends on what you're trying to treat. If it's odor, then a deodorant is fine. But if you're talking about increased sweatiness, then you would need an antiperspirant.
Okay. Thank you.
Welcome.
As always, if you have questions and don't want to say it out loud, you're welcome to just type it in the chat as well.
And I'm happy to answer any questions later on, even if not related to puberty. Anything with pediatrics, you all can reach me through Fatima Bain or Rashida Bain at any time.
Fatima, Ben, you had, sorry, another question. You had mentioned the breast development in boys. So I see like gynecomastia often, and it can be quite distressing for boys, like you had mentioned. For the most part, it's pretty benign and it will resolve on its own. But is there any circumstance where you would worry and send them for, testing, or send them to you to try and figure out what's happening?
Yeah, sure. So the child, for example, that I saw today is Rashida Bain. It was breast development, which is asymmetrical, more on the right side. Galactoria, hockey player, did not want to go to hockey now because he was getting teased. So still benign, but causing a lot of mental health issues.
Yeah.
So these are the kids that, I do want to reassure them that it's still an ongoing, it's normal. But so, I did send this kid for blood work and ultrasound just to make sure that I'm not missing anything because of the galactoria. So those are the kids, yes, you do want to send them forward. And even for myself, if I find some issues, I would redirect this kid again to a pediatric endocrinologist or even an Allison medicine physician if the mental health issues are affecting this kid a lot. But it's not even boys. I see girls coming and they're concerned that their breast is one side is bigger than the other, and they're concerned about that. And the same thing, it's just all about asymmetry. We are not the same on right and left side for all of us.
Yeah, that's a good point. We're not always going to be symmetrical. So, yeah. Thank you.
I think before I leave, I just wanted to add, because if people have missed Dr. Kapasi's talk last time, she talked a lot about the different options that are now available when you have menstrual periods and cycles. You have tampons, you have pads, you have the Diva cup. So definitely keep options open and talk to your child. Your child might actually have looked up on the internet and would have come up with what they think might be a good option for them. And a lot of us may not be ready to talk about something because we have not used it. We might have just used pads and we don't know how to use the tampons and the Diva cup. So maybe that you might want to go and let your child talk to the physician and see what, have a discussion about the options, because there are lots of options that now are available, and that should not stop the child from either doing sports, including swimming. So just something to keep that in mind, because that is really important for their mental health.
Thank you for that, Fatima Bin. I just while we're just waiting for more potential questions, I just wanted to also just bring up the next series. And hopefully, at some point we can have you back as well, doing some talks. But the next series is all about living healthier lives. So the topics are going to be in line with that. So we're going to start off with a healthy diet. We're going to talk about exercise. Obesity. We're going to talk about good sleep, getting good sleep hygiene. We're going to talk a bit more actually about child mental health. So just going on this. This is obviously related more to puberty, but focusing on child mental health, OCD, oral health in adults and children, heart health, vaccinations, dementia, cancer screening. So there's a lot to come. So please stay tuned. We'll be sending out more information about that as well. But if there are any topics that you feel you'd like to know more about or learn more about, please reach out to us at any point. We're always open to hearing what you want to know more about, and then we can arrange it accordingly. So it looks like there aren't any more questions, but Fatima bin, Rashida bin, do you guys have anything that you'd like to add?
No, I'm good. As I said, if anybody needs any other questions or something to think about later on, I would be happy if they reach out to me through you guys or however they find me.
Thank you very much. Rashida, anything you want to add?
No, other than, yeah, thank you so much, Fatima Ben, for your talk. And like you said, it's been a really, really great series. Sorry?
Thank you.
Just that it's been a really, really great series. And yeah, like Fatima Ben said, we really appreciate your support, and there's a lot to come. So lots of interesting, exciting topics that we're gonna love to share with you all. So please stay tuned. And please reach out to either of us if you have any questions. Like Fatima Ben said, any topics you'd like to hear us discuss, anything really, just reach out to us, and we're happy to answer your questions or have a discussion.
Thank you, ladies. And thank you, Dr. Fatima. And of course, Dr. Fatima, the other Dr. Fatima, and Rashida. It's
Thanks,
nice to
Sakina
see
Ben.
you, Fatima.
Thanks, Akina. Take care. Bye, guys.
Take
Good
care.
night.
Bye.
Yeah.
Have a
Good
good
night.
week, everybody. Thank you.
Bye.
Thank you.